Hello all you YouTube junkies. I'm Lloyd Miller and I have a video just for you who are perhaps facing a new challenge. It is called Macular Degeneration, a Patient's Point of View. Macular Degeneration, a Patient's Point of View. The purpose of this video is to help, if even in a small way, those patients that are in the beginning stages of treatment for the wet form of macular degeneration. Some of these suggestions may be appropriate for patients with declining vision of all types of eye problems. The internet is full of descriptions and pictures of the two forms of macular degeneration by highly trained ophthalmologists and retinologists. You can find the most current research and procedures by just putting macular degeneration in your browser. My purpose with this video is to show you some of the tricks and equipment that I have been using to help cope with declining vision. First of all, let me tell you my situation. My mother was well on her way to being blind at age 82. She was legally blind at 85. My recently deceased brother had declining vision and was getting Avastin eye shots. I have two first cousins with macular degeneration. I am 82 and have been getting Avastin eye shots in both eyes every 4 or 5 weeks for the past 2 years. I am sure the eye shots have kept me from completely losing the effective use of my sight. The idea of getting an injection in your eyes is repulsive in the least, but in actuality it is a painless, easy procedure which takes about an hour. A technician puts some deadening drops in your eyes, takes some pictures of the retina with their specialized equipment, and tests the level of your vision with the usual equipment. You will then receive more drops, followed by a half-hour waiting period. The retinologist will then come in and examine the photos and look into the eyes. After some sterile procedures, the shot is administered in through the sides of the eyes. This takes only a few moments. It is painless and quickly over with. On the internet, you can find discussions concerning the 3 substances that are used in these shots: Avastin, Eylea, and Lucentis. My shots have been Avastin, which is much less expensive than the other 2. As you progress into the ages of the 60s and onwards, be sure to check in with your ophthalmologist, especially if older members of your family are known to have macular degeneration. 2 years ago, after a routine appointment, my ophthalmologist immediately referred me to their retinologist, who in short order started the Avastin shots. Left unattended, macular degeneration can do some serious damage to the retina. If your eye doctor suspects the onset of macular degeneration, he or she will give you an Amsler grid as a self-check for the progress of macular degeneration. This is the Amsler grid. And the way to use this you must look at first one eye covered, then the other eye covered. And if they both are straight with no blurs when you look at this center dot, then your eyes are in pretty good shape. The thing that sent me to the retinologist a couple of years ago were these wavy lines. The ophthalmologist noticed those and sent me to the retinologist, who immediately started the Avastin eye shots. 2 years later, after all those shots, I'm still having a blurry section down here at the 7 o'clock area. And this area is far enough away from that dot so that it is not really disturbing too much. Now the left eye, right after I started the shots on the right eye, it wasn't long before the left eye started to gain some distortion. Now this eye has not done so well with the shots. Notice that the blurry area is encroaching on the dot, which means that you're not being able to center your vision on words and small items. It's kind of, you think that maybe you can just move your focus over here to see what's over here, but what happens is that everywhere you move that focus, the blur and the distortion follows along. Here's a case of reading a more practical application of this, is that this is about font 20. With my right eye, I can read this very well with the left eye closed and with not too much of a problem. But when I close the right eye, this is what happens. Everywhere I focus on a word, that word and its surroundings more or less disappears. Now this is not completely accurate. It would take an artist to draw this or to paint this up the way that it actually looks. But this is what happens. When you look at a particular word, you can't see it. And that would be true of any close work that you happen to be doing. And so it's important to keep track of this Amsler grid because it will tip off early on if something is going wrong, and at that point you should immediately go to your ophthalmologist or retinologist and start working with them on these issues. I hope this video has been helpful in some way. Many of these suggestions took a couple of years to work out. There are several more YouTube videos planned on this subject. One that emphasizes audiobooks easily available in most libraries, and the State Library System audio reading machine for the blind and visually impaired. Another will emphasize the iPad and the computer and some suggestions on how to make these machines easier to use. To access these videos on the computer, use the keywords macular degeneration video, macular vision problems. This video is not connected to any company or agency. I would simply like to help in any way that I can to aid those who are struggling with vision problems. Macular degeneration is no joking matter, but neither is it the end of the world. You can contact me by email at lloyddmiller@msn.com or lloydsplace.org, or by phone in the summer 847-515-2164, or in the winter 623-214-7741. Goodbye for now until we get that next video ready.